Now, you're a cognitive behavioral therapist in the mold of Albert Ellis and Aaron Beck, except I think you've gone way beyond them.
Thank you. Yeah, that's the idea. I loved learning from Ellis and Beck. When I was at Penn, I was doing psychopharmacology and research on the chemical imbalance theory about the brain, and I was pretty unhappy with the poor results I was seeing in my patients. I would give them pills and pills and pills, and they would talk and talk and talk, and nothing would ever seem to happen. And then when I heard about cognitive therapy, that Aaron Beck, who recently just died, sadly, he lived to be over 100.
Wow.
But he had started it at Penn, and I thought it was really flaky, and decided to try it with some of my more severe patients just to satisfy myself that it wouldn't work. And then it did work with an awful lot of them. Yeah. So I was supposed to stay on the faculty. I had federal funding to develop a brain serotonin research laboratory at the medical school. And I just said, I don't want to do this. We've proven that the chemical imbalance theory is wrong. We published a paper in the top psychiatry journal in 1975 proving that this theory couldn't be correct. And it's only recently that people have finally accepted this, that the chemical imbalance theory was not valid. It's not the cause of depression. But I saw something that was working for my patients, and I said, this is what I want to spend my life doing. So I left the medical school. I stayed on the voluntary faculty and developed my clinical practice. And it's been a joyous ride. And initially I was thrilled with cognitive therapy, but then saw some areas where cognitive therapy and all forms of therapy were kind of failing. There were people who could be helped and others who weren't being helped. And I wanted to find out why. And the research and clinical experience that answered that question led to what I now call team CBT, which in my hands is dramatically more effective than the original.
Yeah, we're going to be getting into that.
Yeah,
because I was going to ask you. I was going to say that the subtitle of your book, The Claims of New and Revolutionary, are pretty bold.
Yeah, that's right.
What is that based on? You had an earlier book called Feeling Good. So we've gone from feeling good to feeling great.
Yeah.
What's the difference?
Well, there's four crucial changes from the original cognitive therapy and what we call team CBT that have led to dramatically faster recovery from depression and anxiety. That's the huge feature. I was always able to get pretty rapid recovery with many of my patients, but that meant like 5 or 6 or 8 or 10 sessions, which was considered almost impossible in that era of the 1970s and 80s and 90s. But then since we came back here to California, and since I've been at Stanford since about 1995, roughly, I've developed a weekly psychotherapy training group, which is free to community therapists. They can come to Stanford 1 day a week and get unlimited free psychotherapy training. And we've developed this new approach. And now the speed of recovery has changed so much. If someone had told me it was possible 15 years ago, I would have said they were a con artist. And what I mean is that 90% of my patients recover completely the first time I see them.